What is the mission at Infinity Core? I will tell you it's all about seamless collaboration across the care continuum. It seems like a fancy set of words, but really it attacks the core problem that we're trying to solve, which is break down the silos of data and make that data available to everyone in the care team, in the family, the patient themselves, so that they make those educated decisions about their health and wellness. Each one of us is different. You can't generalize the way you treat people, even if it's the same condition, because we react differently to medication, we react differently to treatment, so healthcare needs to be personalized, and that personalization does require vast amounts of data that must be put together, and that siloing of data gets in the way of us being able to deliver on it, so that I could give you that personalized treatment. Don't disrupt, don't completely change the way they do healthcare. The last thing they want is more technology, more applications, more solutions, more data. They're overwhelmed already. They need to focus on patients. Don't jump 5 years into the future. You leave everybody behind. The idea is you should start with our everyday problems, so address those before you go tackle those bigger problems. I consider myself very fortunate. I had the opportunity to work at Microsoft, at Amazon, where I led healthcare initiatives. And I've read a lot about what other companies have done. Great technology companies, there's no problem that they divert their energies to they cannot solve. Healthcare, unfortunately, has been a struggle. It's not so much as the cost of healthcare, it's the fact that we are very inefficient at it, very siloed, very disconnected, and that's what needs to be fixed. The idea is technology should fade into the background so that I get to focus on you. I remember talking to Christine, one of the case managers at a leading hospital in California, and she told me as soon as the patient leaves, the case managers start making phone calls on a daily basis, sometimes hourly, trying to track where the patients are, how they're doing. How could that be in today's age where everything is connected? Hospitals, case managers, doctors don't know what's happening with their patient. That disconnect and that fact that exists today, which is data is siloed, gets in the way of our ability to truly deliver quality care. I love working with our team because of the fact that they have so much passion for this space, just like me. Each one of us needs that extra help, that extra connection with our loved ones. I'm like everybody else. Eventually, I will need help. Looking at my mother right now and how much guidance and how much hand-holding she needed for her to stay healthy. Imagine a world where technology is applied in a correct way, where it starts with us, with each one of us, the patients at the center of that care, where we are connected to our care team, the provider, the nurse, the caregiver. I would love to empower people to own their data. Each one of us should own that data. Not the doctors, not the hospitals, each and every one of us should own that data.